Hi, everyone. Thanks for joining. My name is Jamesia Hoyle, and I'm the chair coordinator for the Next Generation Global Health Security Network. So we're going to go ahead and get started. I want to first thank Dr. Bali for joining us today for our webinar series. Just to give you a little bit about her background and bio. Dr. Bali is an international development and global health specialist and a Global Governance Futures 2027 Fellow for the Working Group on Global Health and Pandemics. In the past, Sulzhan has worked on multiple projects with the World Bank as an instructor for University of Maryland's MOOC on the lessons for Ebola, as well as with Public Health Foundation of India's Immunization Technology Support Unit. As the current core panelist and the former director of production and HR for This Week in Global Health, an online and video global health podcast, Sulzhan has regularly provided commentary on global health issues. For her work with TWIGH, Sulzhan has featured as a prominent leader in global health in the 300 World Leaders in Global Health campaign by the Graduate Institute of International and Development Studies, Geneva, and The Lancet. Sulzhan holds a Master's of Science in Global Health from Duke University, where her interdisciplinary research explored the impact of Ebola on Nigeria's private sector, as well as the private sector's role in the Nigerian Ebola response. Sulzhan completed her doctoral studies in molecular biology with the Medical Research Council UK, and holds a Master's of Science in Molecular and Diagnostic Virology from the University of Manchester. Sulzhan can be reached via Twitter at Sulzhan. So I want to welcome you, Sulzhan. Before we get started, I do just want to remind people that we are fielding any questions from the chat box. So if you do have questions during the webinar, we ask that you just type them in and we'll make sure that they get relayed over. We're definitely looking forward to a lively and engaging discussion today. So with that, I will hand it over to you.
Hi, Jamesia. Thank you so much for bringing me on board. And it's a fantastic venture that you're doing. And I feel that next generation definitely needs to be involved in global health security. So very happy to be here. So today, I would like to talk about, health security in the next decade. 2030, in the next 13 years, we're looking to achieving SDGs. So what exactly does health security and resilience look like in the next years? What are the challenges? What are the obstacles, and how we should go about? So today, I'd like to discuss two papers that I was involved in. And we'll be talking about the first paper that talks about the gaps, differences, and synergies between global health security agenda and the Sustainable Development Goals, which has been a huge push in the last 2 years. We'll talk about the interdependencies between the two frameworks. What has the progress been made so far in health security? And then what exactly are the plausible pandemic futures can look like in the next decade or so? And that I will be talking about this report that I was privileged to be involved in. So the first paper, just so people can access this, and I'm happy to share the paper with you after the webinar is over, is the Sustainable Development Goals and GHSA paper, Exploring Synergies for a Sustainable and Resilient World, that I co-authored with my lovely co-author, Jessica Taff. And the next report that I'll be talking about is Plausible Pandemic Futures in the Next Decade. This is a report by Global Public Policy Institute that I took part in as a Global Governance Futures Fellow. So this is the other report that I'll be sourcing a lot from. So coming back to the first point, what are the synergies between GHSA and SDGs? And just so I can remind our listeners, since 2015, so much has changed in global governance landscape. We've adopted Sustainable Development Goals. We have adopted Paris Agreement at the 2015 UN Climate Change Conference, the first ever legally binding global climate deal, by the way. And then obviously, post-Ebola, we have also seen the expansion and rollout of the global health security agenda in alignment and synergy with the joint external evaluation. So immense harmonization happening there for increasing country capacity and compliance to the legally binding international health regulations. But of course, when we talk about global health security agenda and SDGs, one would wonder, okay, there are two different frameworks. How do they align? So I'm going to kind of break it down one by one. So before I do that, I'd like to kind of talk about the gaps or the criticism one often hears about SDGs, especially from the point of view of health security or addressing pandemics and health emergencies. So as I mentioned, earlier this year, my colleague Jessica Taff and I wrote a paper to highlight how there are gaps in both global health security agenda and sustainable development goals. So on one hand, global health security agenda is considered a very narrow, focused framework that's just addressing, health security or addressing pandemics, epidemics, or health emergencies. So it's considered really narrow. And then there's always the concern that everyone talks about that global health security agenda is going to lead to securitization of health. And often I think it's just because it has the word security. But if you look back in history, you'll see that viewing epidemics as a threat to national or international security has actually led to much more political awareness, much more funding for epidemic responses. And you could see that in the recent Ebola and Zika epidemics as well, where the funding only happened once it was declared a public health emergency of international concern, once it was considered a threat to the security of different countries. So that's a big criticism that GHSA has. It's considered narrow. On the other hand, we have the Sustainable Development Goals with 17 different goals ranging from poverty, clean water sanitation, gender equity, sustainable cities, good health. So 17 goals, 169 targets, and more than 230 indicators. So there's so much going on there. But the argument that one often hears with SDGs is that, okay, if everything is a priority, nothing is a priority. So, there's only a limited financing pie, as I like to call it. And if everything is a priority, how do countries prioritize? And at the same time, when you talking about health security, if you actually look into detail in the good health, the third SDG goal, which is a health goal, there's actually not a single mention of epidemics or addressing epidemics. So, there are clear gaps. So obviously following that, one actually thinks that, okay, so SDGs doesn't focus on epidemics. On the other hand, you have GHSA, which is basically a framework, but with very limited financing to back it. So how do we go about next? So even though SDGs and global health security agenda are very different and with clear gaps, but one could argue that if taken together in alignment, in synergy, both of these frameworks have spillover effects that benefit health security. Both Sustainable Development Goals and Global Health Security Agenda, they call for multi-sectoral collaboration of coordination between governments, private sector, civil society. They both promote global public goods, and they both represent a grand convergence of health. They both complement each other because by addressing poverty, climate change, and economic and health disparities, Sustainable Development Goals actually mitigate many of the risks that pertain to epidemics. Because when people are healthy, they can work, they're more productive, they can contribute to the country's economy and development. At the same time, you have the goal number 3, which talks about universal health coverage as a very important target. And when we talk about universal health coverage, the quest towards it includes access to quality, affordable, and essential medicines and health services, protection for financial catastrophe due to illness, and equity. And one could argue that public health crises in the past, such as Ebola in West Africa, Zika in America, cholera in Yemen, have highlighted how epidemics disrupt access to essential health services. We saw this in Ebola with, increased mortality, increased maternal mortality, and increased burden due to tuberculosis, due to HIV. These epidemics actually push affected persons into financial catastrophe, and we saw that in Zika as well. They contribute to unequal burdens. They further disproportionately affect the poor and the marginalized communities more, which leads to greater inequity. So one could argue that universal health coverage includes a very important component of resilience, and protecting against health risks, against epidemics, is a very key part of universal health coverage. And it defines, because universal health coverage is a broad range of services. It includes even pandemic preparedness. So one could argue there is a lot of synergy between global health security agenda and SDGs. On the other hand, global health security agenda, because it protects people from diseases, from epidemics, and it reduces inequity. It builds, by building core capacities for IHR, you're improving the spillover effects of global health security agenda on the SDGs. And one example that I really like to give is immunization, for example, or access to essential medicines and vaccines. That can reduce incidence of AMR. Now, access and supply chain, and access to services, health services, essential health services, is a key part of the number 3 for SDGs, but it also affects global health security agenda because it reduces the burden of antimicrobial resistance. So yeah, a lot of synergy between the two. And, I'd like to show a diagram from the paper. I don't know how clear it is, but basically this diagram from our paper, which I'll be very happy to share, our paper showcases that how different components of both global health security agenda impact SDGs, because by improving resilience of countries of communities against epidemics, you're basically helping them reduce inequity, which can happen after epidemics. So definitely a lot of synergy right there. And another example I would like to give here is the impact. Obviously SDGs is very often, people say its focus is a lot on climate change. And let me give you an example of a country like Yemen. In Yemen, the conflict started because of climate change. And you could see that how water crisis led to civil war, and civil war means conflict, and conflict-prone areas are ripe grounds for epidemic. And right now we're seeing an immense cholera outbreak happening in Yemen, where 1 in 10 people in Yemen have cholera, a preventable disease. That's what happens. And that is the interlinkage between the Sustainable Development Goals and GHSA. Together, they can actually achieve synergy and reduce the threats posed by pandemics. So one of the other things that I also wanted to talk about, obviously we've discussed that there's a lot of interdependencies between SDGs and global health security agenda frameworks, but there's also this concept of smart global health that I kind of skipped earlier. But smart global health means global health action that leads to spillover effects. That's not vertical, it's a horizontal way of looking at global health. It's problem specific, but it involves different areas, collaboration between different areas, collaboration between lawyers, collaboration between doctors, healthcare workers. And that's a way of looking at global health. And another example where I would like to give that, is that, for example, smart global health, or practicing global health that has spillover effects on diplomacy, is a huge leverage for foreign policy. So, for example, you have health-related ceasefires in conflict areas, which is a huge synergistic, both diplomatic and a global health gain that can be achieved in global health programs. On the other hand, you have situations like Syria, where conflict is going on, but the aid convoys in Syria are destroyed, which demonstrate how warfare can impact health. So investing in a synergistic alignment of achieving health security and sustainable development goals, you have an opportunity to take an advantage of a small window of opportunity that not only enhances diplomacy and brings together disciplines of public health, management, international affairs, trade, but it also promotes stronger alliances between countries to achieve resilience. And we've seen that with the Paris Agreement, of course, notwithstanding the recent news that we've been hearing on that. We've seen that with SDGs. When countries come together, change happens, and it's a huge win for both diplomacy and global health. So that's another point that I'd like our listeners to remember on this. And of course, there's a lot of progress that's been made so far when we talk about health security. Even in the last 2 years, of course, the SDGs and the Global Health Security Agenda rollout. We've also seen World Bank come up with the pandemic emergency financing facility to immediately respond to pandemics, to help countries with financing of pandemic response, so to this insurance policy, and it's a huge win. We've seen World Health Organization come up with contingency fund for emergencies, the Health Emergencies program, and of course, we've seen the launch of Coalition for Epidemic Preparedness Innovations and a public-private partnership that's aimed to facilitate research and development for diseases that can cause potential pandemics and high-priority diseases, as listed by WHO. So there have been huge wins in the previous 2 years. So what exactly can the plausible futures of pandemics look like in the next coming years? What are we going to see in the next few years as we are reaching our sustainable development goals towards 2030? And for that, actually, we conducted an exercise, and I got an opportunity to participate in an exercise with representatives from different countries. This is called the Global Governance Futures Fellows. So it's a fellowship given by Global Public Policy Institute, along with a bunch of other partners, including Brookings, Tokyo Foundation. So what we did was we actually looked at the trends that are happening in the next decade, and we also looked at what are the uncertainties that can happen, and then developed some plausible scenarios that can happen. Just to remind our listener, they're not probable, but they are plausible, just so we can think about what are the challenges that the world faces, even as we, go on the road to achieve sustainable development goals, and even as Global Health Security Agenda is being rolled out in collaboration with WHO and the JEE exercises. So one of the key, sorry, I think here it is moving. So one of the pandemic futures that we looked at was, how weak health systems and vaccine skepticism or misinformation can lead to poor pandemic response in the next decade. So, right now, even though we have vaccines available, we are seeing a rise in misinformation about vaccines. You are seeing increasing vaccine skepticism. And in the next decade, that is definitely something to watch out for. How can you improve risk communication, so that diseases which you've already eradicated, so for example, in the scenario, which in the report, which I'll be happy to share, my colleagues described a plausible scenario where diphtheria actually comes back. A preventable disease can still cause an outbreak. And we're seeing that with cholera right now as well. It's a preventable disease. But, how conflict and how skepticism about vaccines can affect how pandemics can happen in the future. One of the other scenarios that I was actually involved as well in was looking at how in the next decade, we are going to see an increasing response capacity. I mean, already we are seeing with the launch of PEF, with the launch of CEPI, with the launch of Contingency Fund for Emergencies by WHO, we are seeing a bolstering of global response capacity. At the same time, we are also seeing that new antibiotics and vaccines are being, there's a lot of push towards research and developments to discover new antibiotics, to discover new vaccines. And we're seeing that with a lot of different public-private partnerships, not just CEPI, you have public-private partnerships such as CARB-X that's focused on antibiotics. So we're seeing a lot of push. In the next decade, we might actually see new antibiotics and vaccines for some diseases. We're also seeing a push towards development of capacity for human resources, for increased IHR compliance with global health security agenda and JE exercises. So what does that mean? Does that mean, are we prevented from pandemics as we achieve our SDGs? Maybe, but maybe not. One of the plausible scenarios that we developed is that even as we're seeing a change in the the epidemiological burden across the world right now, we're seeing NCDs are rising across the world, in India as well, which is where I'm from. It's the biggest killer is actually NCDs and heart disease. It's not communicable diseases. So you are definitely seeing a lot of change happening. But at the same time, you're seeing a lot of new multiple stakeholders, coming up. So what does that mean? Well, it means even as a response capacity will get bolstered, attentions might shift away from communicable diseases towards addressing NCDs. And it can mean that there might, even though surveillance is a key component of both global health security agenda, as well as within the SDGs, but surveillance between humans and animals, so One Health surveillance can get affected as we shift our attention away from pandemics. At the same time, you're seeing increase in technology, and with increase in technology, you see rise of digital health, of mHealth, but at the same time, there is more potential for misinformation to spread quickly. So in our scenario, we kind of looked at how misinformation and fear can actually lead to fearonomic effects, and how it can affect an outbreak. So an outbreak may happen in one country and it may sufficiently be contained, but the fear of the outbreak can be greater because high impact and low probability events can often distort decision making. And just to give a very quick example, during the 19th century cholera epidemic in Europe, you had riots and disturbances, and much of the outbreak was blamed on Polish minorities. At the same time, during Ebola outbreak in West Africa, there were rumors that foreigners or doctors were disseminating Ebola to wipe out local population. And that led to actually assault on aid workers and doctors in Guinea. On the other hand, in Western countries, individuals traveling from West Africa, and there was an example, this happened to me too, I was coming back from Nigeria, were viewed with suspicion or quarantined as potential vectors of Ebola transmission, even if they were traveling from Ebola-free countries. So there's a huge point where fear can actually dictate in such scenarios. So while we're building our capacity for response, we must remember to build capacity to contain misinformations, to enhance risk communication and reduce rumors, or build capacity for rumor management. At the same time, in the next decade or so, one of the big challenges is also going to be hoarding. How fear of getting an epidemic, if an epidemic is happening in country A, country B, which may be, having number of flights from country A or people from country A, might actually be more afraid. But because if it's wealthier, it might divert treatment from where it's needed more, which is country A. And this was actually observed in the 2009 flu epidemic, when developed countries placed large orders and bought virtually all of the flu vaccine supply, which led to obviously frameworks such as the Pandemic Influenza Preparedness, or PIP framework, for promoting stockpiles for flu vaccines. So that still poses a great challenge. So, obviously in the end, what I would like to say is that global health programs, as we look at health security in the next decade or so, as we get on the road to achieve SDGs need to address the complex nature of epidemics. It needs to take into account interdependencies between global health security agenda and SDGs, focus on investment in interventions that can improve health outcomes, but at the same time enhance preparedness, such as immunization, such as achieving universal health coverage, building capacity for preparedness and surveillance. They also need to take into account more accountability. Despite global health security agenda's efforts, there are still no built-in accountability or governance structures that promote compliance within the IHR articles, even though they are legally binding. So maybe we need to have a body that can leverage greater accountability through fines or sanctions. And we, something, for example, like a WHO or World Trade Organization Commission. So that is something we also need to look at. It's a big challenge, challenge for governance of IHR accountability is a major challenge that we will still continue to see. And obviously we need to focus a lot on collaboration, because health security, as I talked about, is more than just epidemics. It's more than just addressing health emergencies, and it needs to be seen in alignment with other frameworks such as Sustainable Development Goals. So that's all, and I'll be welcoming any questions, Jamicia.
Awesome. Thanks, Sulzhan, for such a wonderful presentation. So we do have a couple of questions, but I do want to remind people, if you do have questions for Sulzhan, please just type them in the chat box and we will get to those questions. So I'd like to start first question, and it is, just a second.
Jamicia, as you are looking for questions, one thing I would like to mention is that I really appreciate having next generation global health security platform available, because I feel knowledge sharing is such a key proponent if we are to achieve global goals such as achieving global health security and sustainable development goals. So it's a fantastic effort.
Thank you. Okay, let me get to the first question. Okay, so it says interdependencies go beyond just formal commitments under and the Sustainable Development Goals. Where are SDG experts intersecting those, and what kinds of projects best exemplify GHSA synergies?
I'm going to ask you to repeat that, Jamicia. I think you broke in. So the question is that can you repeat the question? Because I think you kind of broke in the middle. Hello?
Sure, I can definitely repeat it. So it says interdependencies go beyond just formal commitments under GHSA and SDGs. Where are GHS and SDG experts intersecting most prominently today? And what kinds of projects best exemplify GHSA and SDG synergies?
That's a fantastic question, first of all. And I absolutely agree with the person who's asked the question that interdependencies need to go beyond formal commitments. It's one thing to just have a formal commitment or even legally binding solutions, as the Paris Agreement is, but we need to see action at the implementation level. And where I would say that's happening the most is in programs which are promoting surveillance, at programs that are promoting immunization, at programs that are improving access to service delivery, essential services, under universal health coverage. I feel those are the areas where you see both SDGs and global security agenda come together the most. You're also seeing synergistic, another area is obviously climate change. And because as we focus more on preventative efforts for reducing climate change, it will definitely have some impact on reducing the impact of or the spread of certain diseases in other areas. You're already seeing mosquito-borne diseases become much more prevalent in areas where you did not see them before, such as United States. And I feel by having the legally binding commitments through the Paris Accord, we're also actually focusing a lot on, to some extent, reducing that. But at the implementation level, you're definitely seeing that most with immunization programs and surveillance programs that countries are conducting. And you're seeing a lot of programs that are happening, being funded by World Bank, being implemented with advice from WHO that are doing that.
Awesome, thank you. So the next question is, both GHSA and SDGs share nominal commitments to multi-sectorial and multidisciplinary collaboration between stakeholders. Are these imagined similarly between SDGs and GHSA, and are there any differences?
So that's also a fantastic question. So I feel because both of these frameworks are addressing global challenges, in a certain aspect, they're also similar in terms of that they're both calling for collaboration by the private sector, by governments, by civil societies, by international organizations to come together in harmony to achieving them. Having said that, I feel you could see much more action happening also at the global health security agenda level, with GHSA and the JEE assessments happening. There is a greater drive for bringing different stakeholders to the table. And there's a greater, because earlier when you talk about, say, pandemic preparedness, or when you talk about addressing health security challenges, you would mostly, interact with, health ministries. But now there is definitely a greater call for engagement by different ministries, ministries of agriculture, ministries of education, to be involved in these things, Ministry of even defense. So you are seeing that happen more so. And to a certain extent, they would be similar in that they're calling different stakeholders. But I feel in terms of global health security agenda, there's a greater need to involve different stakeholders to come for table. And it should be the case for all the global goals, or all the global challenges that we're addressing, because they cut across. Gender equity, for example, in SDGs also affects the economy of countries. You reduce inequity, so that also impacts education and equality. So they're all interlinked to some extent. And economic growth will only happen if you have good health, if you have reduced inequities, if you have greater education and greater gender equity. So in a sense, it would happen in a certain similar level for both the frameworks. But I can definitely talk more about health security agenda, global health security, than I can speak for SDGs.
Okay, thank you. So early in your talk, you mentioned how funding is connected to emergencies, and there's this sense of bringing political awareness, particularly in how maybe GHSA is seen to be securitizing health security. Mm-hmm. As we move forward, just this week, the Next Generation Group, along with a couple of other organizations, the Global Health Council, the Global Health Security Agenda Private Sector Roundtable, and the Global Health Security Agenda Consortium signed on to endorse an extension of the Global Health Security Agenda, where we're looking at GHSA 2.0 essentially. And so in this letter, we made a strong urge that all countries make and implement specific commitments with a focus on financing strategies to fill gaps identified by external evaluations. And so, as you know, you go through the JEE process, and at the end there are these gaps that are identified, and now countries are having a little bit of an an issue of how to fund and really meet the metrics that were identified under the evaluation. So I just wonder if you could talk a little bit about how we really move from what we see as funding being prioritized to pandemics to where we're really preparing countries early on for pandemics, but also strengthening the healthcare systems even before a pandemic hits or epidemic hits.
I think that's a great point that you brought up, Jamesia. It's great that we're having an increased push for assessments through JEE and Global Health Security Agenda, but then that's one thing. But then another thing is obviously implementing it. That's the next step. So now you know, okay, these are the gaps, but the next step is how do we fill those gaps? And that obviously requires financing, that requires commitment politically, and that until that happens, we would not achieve global health security, so to speak. So it is really important to actually talk about what are the next steps, how countries are going to implement. And I know there's already a lot of, lot of action happening there. You know, some countries are utilizing the JEE and, you know, coming up with action plans to, you know, to what to do next. But for many countries, how do you fund that? And, you know, a lot of countries are dealing with multiple problems, you know, so maybe infrastructure is a bigger, it's more prioritized in a certain country, maybe addressing other challenges, economic stability or political stability is more prioritized. And this is where we need more advocacy. We need to change the narrative. We need to make sure that the narrative actually explains the importance and make a financial case for investing in preparedness. And that's what's really important after the JE. So I think as we think about global health security agenda 2.0, we need to think about how can we make a case for investment in global health security? How can we mobilize financing both within the countries and also internationally? And also, how do we ensure that politically, you know, Ministry of Finance understands, you know, these are simple enough. Make a robust but realistic plan that the Ministries of Finance, for example, can help implement. So that's what's definitely needed as the next steps. And also just to quickly come back on the point that you talked about in terms of where the money can come from. And of course, when you actually look at frameworks through synergy, or when you look at goals through synergy, this opens up a huge space or a pot of money as well. So, you know, if you are talking about spillover effects, if you're talking about campaigns such as building capacity for response, building capacity for preparedness, that would actually address both SDG challenges as well as challenges one sees in health security. So there is definitely a need for more money, and looking at things in synergy, working together in alignment is one way of going about it.
Great, thank you. So your talk seems to draw a correlation between technology and potential increase for misinformation. And I wonder if you could speak to particularly how the next generation can play a role in kind of building this capacity that you talked about towards risk communication.
This is a great question also, Jamesia, like I must say. Yes, so in terms of trends that we're seeing, we are definitely seeing a huge trend in mobile technologies. You know, as smartphones become cheaper, it's, you know, we have a huge tool that we can utilize in smartphones with mobile phones. You know, it opens up a lot of avenues to actually increase access to service delivery in areas that we haven't been able to reach before, and it improves cost effectiveness. But yes, at the same time, there is increased risk of, you know, as information flows more swiftly, so does the misinformation flow swiftly as well. So one way we can go, especially as next generation, ensure that misinformation doesn't flow as quickly is by investing in risk communication. And one example that I often love to give in my talks is Ebola alert in Nigeria. there's a gentleman by the name of Dr. Lawal Bakare. I would definitely suggest look him up. And he started Ebola Alert as Nigeria was reeling under Ebola, as Ebola, the first case of Ebola came into Nigeria. And it's a fantastic effort. So it's a social media-based platform that he started and actually then joined forces with the government to implement it. And what it did was, social media, for example, is a way where misinformation travels very quickly. And during the Ebola outbreak in Nigeria, there were all these kinds of rumors going around that if you drink salty water, you can be protected from Ebola, or if you eat certain nuts, you're going to be protected from Ebola, or there is an Ebola case here. So what Ebola Alert was doing, it was actually keeping sort of a social media surveillance, like a peer surveillance, so to speak, and it was looking out for any rumors that came up. And then what they would do is they would reach out to the government, with whom they had a partnership, to actually verify, to actually go. So suppose someone said, okay, I think there's an Ebola case happening in District A, they would coordinate with the government and make sure to verify that information, whether or not it's an Ebola case or a food poisoning case. And that actually happened. And it was definitely a very amazing feat, because Ebola Alert was one of the first platforms, that was accessed when Ebola spread from Lagos to Port Harcourt, because the spouse of a patient actually felt much more comfortable to reach out to them to ask for advice. And that again has, accessibility is a huge win and a gain that we can. So by developing platforms such as Ebola Alert, as an example, by developing platforms that reduce rumors, that help governments verify rumors, that reduce misinformation, make sure there's accurate information. Everyone's been hearing about false news and fake news. So as the next generation, let's get our sources right. And if you see something, if a friend forwards you an information that's wrong, help them verify them. So that's a big role that the next generation can play.
Awesome. Thank you for that. I do have another question about next generation. So you talked early on about enhancing diplomacy. And so I oftentimes say that the next generation group is the sustainable arm of GHSA, because we will continue to focus in an interdisciplinary way about how to address these health security issues. And so, as you mentioned advocacy, I'd like to know your thoughts or opinions on some roles or advocacy tools or just advocacy issues that the next generation should look to address as we're looking to fill some of these gaps identified between GHSA, and if we move forward to a new version of GHSA, and the Sustainable Development Goals.
Thank you, Jimisi. Again, a fantastic question. And I absolutely agree with you. As next generation, we are definitely the sustainable arm for global health security. And as next generation, we can play a huge role by, first of all, increasing dialogue. Being part of Bosch Global Public Policy Institute sponsored Global Governance Future Fellowship, I got a chance to interact with fellows from United States, Europe, from China, from Japan. I myself was a delegate from India in that. And it really amazed me, even though we are all global health people, next generation global health and young global health leaders, but our understanding of global health issues really differed based on where we came from. Our priorities differed. Our, understanding of what are the challenges differed. And I feel by improving dialogue, that's one step to coming at the same page. Information flow will always reduce disparities. It will help you understand the other person's point of view. All of this while we talk about countries need to take ownership. And I feel, yes, but the first step comes, with the next generation. Let's get involved in dialogue on global health issues. Let's get involved in bringing global health security to the political agenda, to the both economic and political narrative. And I feel like as next generation young leaders, we can play a huge role in that. We can mobilize advocacy around these issues, mobilize the case for investing in preparedness, the case for investing in global health security, and the case for investing also in sustainable development goals, because at the end of the day, many of them are actually linked. When you talk about health security, when you talk about epidemics, during the Ebola outbreak, there was a foreign policy report actually that talked about how gender-based violence actually increased after Ebola. So and there have been other instances where conflict is actually linked to disease outbreaks, which is linked to gender-based violence and linked to food insecurity. So it's all together. So how do you frame the narrative? And this is a big role that next generation can play. That how do we make a case for governments to invest in this, to make this a priority, to mobilize domestic financing and hold them accountable for this? So yeah, a huge role we can play there.
Yeah, I think those are definitely great thoughts and perspective. We're going to see how we can implement those moving forward. So seeing no additional questions, I want to take the opportunity once again to thank you for just an amazing presentation. And I think this is going to be great dialogue moving forward, both in the realms of WHO and the GHSA, especially as we're moving forward to really think about what the next iteration of GHSA looks like, but also in really bringing a new energy to the next gen group on how we can continue to be actively engaged in all things health security. So with that, I want to thank you. And if you have any closing remarks, I will let you close the webinar out.
I am actually, I don't have much to close the webinar with, except to say that let's continue the collaboration and advocacy to achieve health security, because it's more than just epidemics at the end of the day.
Wonderful. Thanks again.
Thanks a lot, Jamicia, for this opportunity.